Well, you have to define what is healthcare real estate to begin with. So healthcare real estate includes medical office, ambulatory surgery centers, clinics, hospitals, of course, academic medical centers, quite a variety. Just like in the medical profession, there's tremendous variety among specialties of physicians and all kinds of clinicians practicing in healthcare. So it's very complex, very similar to the differentiation of medical specialties specifically. But in healthcare real estate, you have issues related to compliance. You have regulatory issues. You have issues related to, different from commercial real estate, related to HVAC and plumbing, and adjacencies are very important to fit the referral patterns between primary care physicians to specialists to the right setting in the outpatient versus the inpatient. So very complex. Payment reform is very complex. How hospitals can survive in this era of increased cost, increased usage. So it is a truly complex industry. Well, healthcare systems are looking under every rock to find opportunities to reduce costs and drive volume as well as a healthy population. So the idea is if we can reduce our cost structure, and we know we're going to see increased usage because under healthcare reform, whether it stays intact as it is or it's revised, there's going to be more usage because there's going to be more people covered by insurance. So there's more insurance, more usage, more volume, and yet a lower reimbursement for that volume. So hospitals are really looking to see how they can cut their cost structure. They've looked at FTEs, full-time equivalents, and they really can't cut to the bone any further. We want to be cared for. We want the clinicians and the experts. We want the research. We want the technology. We want the latest and greatest. So they're beginning from a real estate perspective to look at how is their real estate being managed? Is it cost efficiently being managed? Is it in the right location? Is the use of the facilities correct? So do we have full occupancy? Do we have issues related to vacancy? Do we have opportunities to consolidate? Hospitals are acquiring physician practices, again, to control the delivery system and impact their usage and their cost structure. And as they do that, gosh, along with the physician comes real estate. So we've got leased space. Do we want to lease it? Do we want to own it? So the financing is being looked at. Do we continue to use tax-exempt money? Do we use third-party capital? Do we lease? Do we buy? Do we own? Hugely complex. So some of the things we'll be talking about at the conference is how hospitals are beginning to navigate that landscape.